What's up, guys? Welcome back to Cherokee Hacks Life. So this video, just like the title says, is really just to show you guys what kind of workouts you should be doing. The first one I'm going to show you, you should be doing immediately after you get your sling taken off, or your doctor tells you to take your sling off. I don't know how long your doctor's going to tell you to take your sling off. My doctor told me to take it off the very next day after surgery. That's what he told me to do. Not sure what your doctor's going to do. My doctor's one of the best in Central Florida. In fact, I think he's probably one of the best in Florida. I would probably say take it off the very next day post-surgery. But again, I'm not a doctor, man. So take whatever advice your doctor gives you, add that in what I'm giving you, because honestly, ultimately what I'm trying to do here is save you guys money. I had the same exact surgery on my right side that I had on my left side, and my stitches are officially out. So 1 week later, my stitches are officially out. I don't think I put that up in my previous video here on what you should be expecting. Basically, I had, I think, one stitch here, two here, or one here, two here, and like two back here, and they just came right out. And then they put these little things with like some glue that stunk. And as soon as it falls off, and then I'll be able to show you guys the scarring. But really, it's not that bad at all. It's ridiculously tiny, the holes that go in. And again, I gotta find a way to get these pictures uploaded so that way you guys can see them. I'll figure it out eventually. But basically, here's the workouts, guys, and I'm kind of break it down for you step by step what exactly I'm doing in each one of these videos so that way you guys can do them at home. And again, ultimately, these are going to be the exact workouts that they're going to have you doing if you do physical therapy. It's going to be the exact same thing. Have something different that's like this bicycle arm machine that you do like this, and you can do that shit on your own. Honestly, you can just fucking just do this. It's basically what they're gonna have you do. They're gonna have you do this. That's one of the exercises, just to kind of get the motion back. Ultimately, what hurts right now is because your muscle, I mean, they had to drill into muscle, and if you have a big ass fucking deltoid muscle like I did, they basically just drilled right into your shoulder muscle. But it's not that bad, so please don't be scared by the surgery. The surgery really isn't that bad. Look, I'm already moving my arm a lot, significantly from what I was last week. Last week I was just basically like this, talking to you guys, and if you guys seen any of my other videos, I like moving my hands a lot, and it doesn't even hurt that I'm doing it right now. So let me show you guys exactly what you should be doing the day after you get your sling taken off. Again, don't baby it, because it's gonna fucking hurt. But it's gonna hurt a hell of a lot more if your arm seizes up. And if your arm seizes up, it just sucks. Is basically the best way I can tell you, because you'll go through physical therapy for weeks, like I did with this arm, because I babied it. So don't baby it. So real straightforward, find a table, lean over on the table, and just swing your arm back and forth as far a range as you can take, and do it slowly. I might be going a little bit fast. You want to lean in as far as possible, go up and down. You want to do a circle as well. So do a circle all the way around, and you want to swing back and forth. So again, that's up and down, a circle, and back and forth. And then you want to take it to the point that you feel something, but you're not like, oh, like you're dying and shit, because it just hurts too much. If it hurts too much, especially the first day after taking it out, it did hurt a lot for me. Take a pain pill right before, but just don't go too far. Don't double dose on the pain pill. Don't go too far. This one is gonna hurt like a motherfucker. This one I would not suggest until you're 1 week out from surgery. So 1 week out, you wanna go up against the door, and you wanna use your fingers to slowly climb all the way up on the wall. Is the best way I could tell you to actually do this, because otherwise, you're just gonna be in pain the entire time when you do this. It's gonna hurt. You can see I kind of just lean back. Next thing you wanna do is hold the doorknob and then turn sideways. So you get that external rotation on your shoulder and on your labrum. And you want to go up a little bit higher. If your doorknob is too low for you, just go up a little bit higher and kind of hold the actual frame of the wall. Again, I tried it the second time around, so here I am doing it the second time around, and I go a lot higher this time, just because I knew I could go higher. I just had to crawl up and kind of deal with the pain a little bit. At some point, you just don't even feel it. You just kind of just keep going. Most of the pain that you're going to be feeling is your muscle tensing up, because again, he drilled through muscle, okay? He drilled through ligaments and through muscle in your arm. So what you're feeling the pain from is your muscle healing inside. It's not that the ligament's gonna pull off. I can guarantee you that the tie down, or the anchor that he put into place to tie up your labrum, it's not gonna just yank off in a couple days. It just doesn't do that. Once it's anchored, man. There's nothing that's gonna fucking just rip that shit off like that. Your goal is to try to get your movement back, but don't baby it. Don't push yourself too far, but don't baby it. Your doctor's probably gonna ask you to want to do this. He's gonna wanna see you get how high you can get with your arm this way, how much rotation you can get, and that's as far as I can get right now because it hurts. How much rotation you can get going this way, and then how far straight up can you put your arm without assistance on the wall. So that's ultimately what he wants, and that did hurt, so now I feel sore. Bring it back down, pain's gone. That's it. So don't feel nervous about it by no means. And again, what I would suggest is, if you're kind of just laying on the couch, because this shit is exhausting. This is probably more exhausting than just going to the gym regularly, because you actually have to you have to go through pain in order to get the movement that was just natural for your other arm. And you fucking just swinging this other arm wherever the hell you want, but then you feel kind of stupid because you can't do the same thing with this arm. So what I would recommend is, if you're laying on your couch, and this is gonna be hard because it's the same shit. I did it in the other video, but if you're laying on your couch, you want to take your arm, right, whatever direction you're in, doesn't really matter. You want to take your arm and you want to, show you guys from this angle, probably be better with the camera. You want to slowly reach over, using your fingers. You want to slowly reach over and try to extend here, then extend up, and then try to extend as far as you can. And again, it's easier when you're laying on the couch. You're not dealing with gravity. There's a lot less muscle being used because it's just your fingers moving across, and it doesn't feel as bad. So that's one way to kind of cheat your way up to getting a little bit extra movement and a little bit extra rotation in your arm. It'll hurt, but it won't hurt as bad as doing it on the wall, but the wall is necessary. Another thing that I would recommend, if you're a stomach sleeper like I am, and it fucking sucks to sleep on your back for the last couple weeks, slowly turn over to one side, turn over to your stomach, and you'll probably start off somewhere in this area, right? And then you'll want to try to bring your arm up slowly and bring your shoulder down onto the bed. And just try to lay like that just for a little bit, even if you're not going to sleep just yet. Just kind of lay like that just for a little bit. So your arm slowly over the next couple days post-surgery gets used to being in a position that you like, that's comfortable for you to go to sleep. So that way you're not sleeping on your damn back the entire time. And that's it, guys. That's basically the suggestions that I have for now for the workouts. I'm going to have a lot of other stuff with bands that you'll be using as well to strengthen the muscle, because ultimately you want to strengthen your shoulder muscle again. And it's just going to be some band workouts, and I'll have those probably in another 3 weeks when I have as much rotation as possible with my arm. And that's it. The band workouts are going to fucking hurt. And again, please don't be scared by this. If I'm freaking you out for any reason on these videos, my apologies. That's not the intention at all. Honestly, I'm just trying to save you guys some money because physical therapy is fucking expensive. I know when I was going through physical therapy, because again, I babied my arm. I just didn't want to move it. I'm like, oh, I didn't want to move it. It was $75, and that's with my insurance each time I went, and I was going once a week. That's fucking expensive, man. You add that up. I was going for once a week, about 3 months. It's a good chunk of change. You're looking at 150, 2 weeks, $300. 3 times 3 months, that's $900 that you'll be saving just in physical therapy, and that's assuming your insurance covers half of it and gives you a certain allotment of time for it. So hopefully these workouts help you. Hopefully this video helps you out, it doesn't freak you out too much. And if you guys have any questions, again, hit me up at Cherokee Hacks Life at Facebook or at Gmail. Either way, or leave a comment down below, give it a thumbs up, and I'll catch you guys up on the next video. Talk to you later.